Welcome to the RT Assessment Tools presentation. There are 4 types of assessments. Non-standardized assessments, also referred to as in-house assessment tools, are tools that do not go through vigorous testing for reliability and validity. These types of assessment tools are facility-specific and they work well for gathering information. Non-standardized tools rely heavily on clinical judgment of the therapist that use them. Standardized assessments, like we discussed in the assessment theories and models presentations, are tools developed to measure limited functions or attributes that have psychometric properties and have some level of validity and reliability that has been established through vigorous testing. Signs are highly studied phenomenon that generally measure one thing. Signs are required to be norm reference and are a warning that something is wrong. Scales measure the where or how much of something. There are 2 characteristics that scales measure. One is traits, which are characteristics that remain relatively stable over time, and the other are states, which are attributes that are changeable and are impacted by the environment. Non-standardized assessments are tools that do not go through research to determine psychometric properties. These are the facility-specific, in-house developed assessment tools that the majority of RT professionals use for their initial assessment process. Most in-house assessments include basic demographics and background information, the client's diagnoses, along with relevant admission and health-related information, and anything else that may be relevant for treatment based on the setting and services provided. A well-developed RT assessment tool will cover all of the following life domains: physical, cognitive, affective, psychological, spiritual, leisure, and social. When designed correctly, the RT will be left with a holistic view of the client. There are a few things that can impact the scope and information included in an assessment. One is the typical needs and strengths of the clients being served. The practitioner must always consider the setting, clients, resources, programs, and potential discharge destination for clients when developing an assessment tool. It is very important to ensure that the tool assists therapists for placing clients in the proper treatment programs. The purpose of the assessment is not to see where the client will fit into the activities that the therapist wants to offer, but to see what activities are appropriate for the therapist to offer in order to meet the client's needs. If a form is not already developed, the RT professional will have to work on designing it. There are some important elements of developing an assessment form. First, the RT must ensure there is a clear idea of the content and purpose of the assessment, as well as the client group for which the form is intended. The provider needs to provide the nature of the assessment process. Will it be an interview, observation, self-administered survey, or record reviews? The design of the form should allow for others to easily find the critical information collected and to understand the treatment plan. The order of the items on the form should reflect the order of the questions in the interview. This will allow the information to be recorded easily and accurately. The provider should remember to ensure that information collected should reflect the needs and characteristics of the population and target clients. The content of the assessments needs to match the content of the program. If not, it is nearly impossible to use the assessment to place clients in the programs. Good assessments are more objective than subjective. Objective data can be described or measured through observation or physical manipulation, such as the distance one can ambulate, the time it takes a client to complete a task, or the client's ability to follow 3-step commands. Subjective data includes thoughts, feelings, preferences, interests, or something that exists only in the individual's mind. The standardized assessment tools included in this section are all related to measuring attitudes. The Cooperation and Trust Scale is designed to measure changes in the client's attitudes about trusting and cooperating with others. Patients need to have a high level of cognitive functioning in order to use this instrument. The Free Time Boredom tool is used to identify the degree the participant is bored in the 4 components that make up boredom. These components are mindfulness, mental involvement, speed of time, and physical involvement. Participants must be able to read at a 4th grade level. The Leisure Diagnostic Battery is the most widely known assessment tool. The Leisure Diagnostic Battery has 4 primary purposes: to enable the therapist to assess the client's functionings, to enable the therapist to determine the areas in which the improvement of current leisure functioning is needed, to enable the therapist to determine the impact of offered services on the client's leisure functioning, to facilitate research on the structure of leisure to enable a better understanding of the value, purpose, and outcomes of leisure experiences. The Leisure Diagnostic Battery measures the following constructs: perceived leisure competence, perceived leisure control, leisure needs, depth of involvement in leisure, and playfulness. The Leisure Scope Plus and the Teen Leisure Scope Plus are assessment tools that are used to identify areas of high leisure interest and emotional motivation for participation of individuals who like high-risk situations. The Leisure Scope Plus uses pictures to help identify client preferences for activity types. Patients appropriate for this tool should have little to no cognitive impairment. The Life Satisfaction Scale is used to measure the client's perceived satisfaction with his or her life. The patient needs to have a moderate to no cognitive impairment. The Measurement of Social Empowerment and Trust tool measures changes in an individual's perception of his or her social attitudes and skills as a result of involvement in treatment program and adventure class. The Measurement of Social Empowerment and Trust focuses on measuring the following constructs: bonding and cohesion, empowerment, self-awareness, self-affirmations, and awareness of others. To use this tool, the client must have moderate to no cognitive impairment. The Quality of Life Index helps clients to evaluate their individual balances of stresses and strengths, and then to make appropriate adjustments within their life activities. The patients need to have moderate to no cognitive impairment to complete and comprehend the Quality of Life Index. The Idle Arbor Leisure Battery is a group of 4 assessment tools that make up this battery. All the tools in this battery are for use with individuals that have moderate to no cognitive impairment. The leisure attitude measurement is used to review and quantify the participant's attitude toward leisure as it relates to the client's cognitive, affective, and behavioral domains. The leisure interest measure measures how much interest the client has in each of the 8 domains of leisure activities: physical, outdoor, mechanical, artistic, social, service, cultural, and reading. The Leisure Motivation Scale measures the patient's motivation for engaging in leisure activities based on the following constructs: intellectual, social, competency mastery, and stimulus avoidance. The last tool in the battery is the Leisure Satisfaction Measure, which is designed to measure the degree to which the client perceives his or her general needs are being met through leisure on the following domains: psychological, educational, social, relaxation, physiological, and aesthetics. The standardized assessment tools included in this section are all related to measuring functional skills. There are several tools in this section. The comprehensive evaluation of RT, psych behavioral, is used to identify, define, and evaluate behaviors relevant to successful integration into society using appropriate social skills. Skills are assessed on 3 performance areas: general, individual performance, and group performance. Individuals need to have a developmental age of at least 10 years to complete the assessment. The comprehensive evaluation in RT, physical disabilities, establishes a baseline for the client's functional skills related to leisure activities on the following 8 areas: gross motor function, fine motor function, locomotion, motor skills, sensory, cognition, communication, and behavior. Reassessment of the same client will help to establish skill recovery or loss. The bus utilization skills assessment is used to determine skills the client has in relation to using public transportation. The bus assessment helps to determine if a client is cognitively and socially competent to use public transportation independently. The FOX evaluates the client's relative level of skills in the social and affective domain. Most of the skills included in this assessment are important building blocks to the development of a mature leisure lifestyle. The 6 building blocks measured in the FOX are the client's reaction to others and objects, the client seeking attention from others to manipulate the environment, client's interaction with objects and others, and the client's concept of self. The Recreation Early Development Screening Tool assesses the developmental level of a client who are functioning at or below 1 year of age and measures 5 areas as they relate to leisure: play, fine motor, gross motor, sensory, and social cognition. The School Social Behavior Scales and the Home and Community Social Behavior Scales are used to measure the social competency and antisocial behavior patterns of youth and to identify students who are behaviorally at risk. These students might benefit from prevention interventions. Both of these tools are designed to be used with youth ages 5 to 18 years of age in school or treatment-based settings. The functional assessment of characteristics for TR is used to determine the client's needs related to his or her basic functional skills and behaviors. The FACT-R measures the following 3 domains: physical, cognitive, and social-emotional. Patients must have a developmental level over 10 years of age. The functional fitness assessment for adults over 60 years is used to determine the functional capacity of older adults in 6 areas of function related to established age and sex-related norms. The 6 functional areas assessed by this tool are body composition, flexibility, agility and dynamic balance, coordination, strength, endurance, and endurance. As the title implies, the tool is designed for use with seniors with physical impairments. The coordination skills assessment are used to evaluate the client's gross and fine motor skills as well as balance related to coordination, ambulation, and mobility. Tests are divided into gross motor and fine motor activities and further divided into equilibrium and non-equilibrium tests. Coordination skill assessments are designed for individuals with physical disabilities. The functional hiking technique helps to determine a client's ability to demonstrate the basic skills necessary to hike independently. The functional hiking techniques measures the client's abilities to select appropriate attire for hiking, demonstrate a pacing pattern, demonstrate an uphill and downhill technique, demonstrate techniques to move over obstacles, and demonstrate techniques to move over under obstacles. This tool was designed to be used with ambulatory clients with cognitive impairment. The Idle Arbor Activity Assessment is used to obtain enough information about the client in a reasonable amount of time to be able to develop a treatment plan. Used in long-term care settings, the Idle Arbor Activity Assessment evaluates the following 5 sections: personal and medical history, leisure interests, leisure history, individual performance, social strength, and maladaptive behaviors. The 50-foot walk test measures the speed the client walks normally, called the preferred speed, the speed the client walks when asked to walk fast, and the number of steps the client uses to walk 50 feet. Measurable assessment in recreation for resident-centered care is used in long-term care settings with dementia residents. This tool is used to obtain relevant demographic information about the resident, to assess the resident's past and present leisure interests and needs, to assess the functional level of 4 domains: cognitive, physical, social, and emotional, as they relate to recreation participation, to create a resident database that enables RT professionals to group residents according to leisure interests, functional ability, safety concerns, demographic information, and special needs, to determine the impact of offered services on the resident's functional level, to assist the recreation professional in developing care plans that are specific to the resident's assessed needs, interest, and functional level, to enable the ongoing assessment changes in the resident's functional level, needs, and interest, to facilitate the evaluation of the appropriateness of the pre-described leisure plan for the resident, and to enable the development of appropriate progress notes that provide a thorough evaluation of the resident's progress towards the accomplishment of care plan goals. The social attributes checklist is used to measure attributes of the child's social behavior related to developmentally appropriate social competencies in the following 3 areas: individual attributes, social skills attributes, and peer relation attributes. Social skill attributes checklist is designed to be used with preschool or elementary school aged children. The therapeutic recreation activity assessment is used to obtain measurements of a client's basic physical functional skills as demonstrated in a group setting. The TRAA measures the following 6 areas: fine motor skills, gross motor skills, receptive communication, expressive communication, cognitive skills, and social behavior. The leisure and social sexual assessment is used to assess and provide a therapist with a tool to assess the breadth and depth of the participants' understanding of appropriate social and sexual roles related to these 3 sections: basic personal data, structured interview, and client's understanding of dating, marriage, and sexuality. The leisure and social sexual assessment is designed for use with clients with intellectual and developmental disabilities. The final assessment tool in this section is the General Recreation Screening Tool, which is also designed for clients with intellectual and developmental disabilities to help determine the client's functional level in the following 18 areas related to leisure: gross motor, fine motor, eye-hand coordination, play behavior, play structure, language use, language comprehension, understanding of numbers, object use, following directions, problem solving, attending behavior, possessions, emotional control, imitation play, people skills, music, and stories and drama. The standardized assessment tools included in this section are all related to measuring participation patterns. The assessment of leisure and recreation involvement is designed to measure a participant's perception of his or her involvement in recreation and leisure based on the following 6 cognitive emotional elements that influence actual participation in an activity. Importance of the activity, pleasure derived from activity, interest in activity, intensity or absorption in activity, perception of self, and meaning of activity. The LRI is designed for use with individuals with moderate to no cognitive impairments. The Leisure Assessment Inventory measures leisure behavior of adults through the following 4 subscales: Leisure Activity Participation Index, Leisure Preference Index, Leisure Interest Index, and Leisure Constraints. The LAI is used with clients with moderate to no cognitive impairment. The State Technical Institute's leisure assessment process is used to help achieve a balanced lifestyle by assessing the client's leisure skill participation patterns, categorizing the patterns into leisure competency areas, and providing guidelines for further leisure decision-making and future program involvement. The STIPL measures the client's indicated interest in various activities, areas that the client is interested in learning more about, and the degree to which the client's leisure lifestyle is balanced and is designed for use with clients with physical or psychological disabilities, as well as intellectual and developmental disabilities. The Recreation Participation Data Sheet is used to monitor a client's leisure activities for a balanced leisure lifestyle in the following areas: participation, initiation, independence, physical output, satisfaction, average age of groups, and average time spent in activities. The RPD is recommended for all populations. The Leisure Step-Up helps the therapist and client measure quality of participation demonstrated by the client. It is part of a leisure education program that helps the client develop the attitudes, knowledge, and skills required to have a healthy leisure lifestyle. The Leisure Step-Up has 3 components: Step-Up Leisure Assessment, Leisure Participation Scale, and the Global Assessment of Functioning, Leisure Functioning. The LSU is designed for use in treatment-based programs. The Vitality Through Leisure provides a therapist or participant with insight into the following: the parts of leisure that currently increase vitality for the participant, areas where leisure choices could be more effective, a more understanding of the way leisure can restore vitality. The Vitality Through Leisure measures how much vitality a person gets from leisure based on 5 components: broaden and build, physical conditioning, relaxation and stress control, optimal arousal, and personal betterment or restoration. This slide will cover a few other assessment tools that do not fit into the other topics discussed in this presentation. The Resident Assessment Instrument and Minimum Data Set are federal tools used in a long-term care facility by all members of the interdisciplinary team. There are federal mandates that guide the completion of these assessment tools. The Inpatient Rehabilitation Facility Patient Assessment Instrument is another federal tool used to gather data to determine payment for each Medicare Part A fee-for-service patient admitted to an inpatient rehabilitation unit or hospital. The assessment is required by law to be completed on every Medicare Part A fee-for-service patient. Both of these tools are completed by various members of the interdisciplinary team as a summary assessment. That means all professionals first assess functional needs using other assessments and then summarize findings into these documents. The Community Integration Program measures different aspects of a client's knowledge and skills in assessing community resources. The modules covered in this program include community, cultural activities, community activities, transportation, physical activities, and independent plan. The Community Integration Program can be used with any population that needs to regain ability to use community resources. The LCM is designed for use with adolescents and adults to assess competency on the following 8 concepts: leisure awareness, leisure attitude, leisure skills, cultural and social behaviors, interpersonal skills, community integration skills, social contact, and community participation. This slide will cover a few signs that RT professionals need to understand, as a deviation in these signs can indicate a potentially negative health-related issue. Vital signs are typically taken daily on inpatient units and during any visit to a provider. The vital signs are made up of the following readings: temperature, blood pressure, respiration, and pulse rate. Signs of edema are used to indicate excess intercellular or intersagittal fluid. And this is a sign that the body is unable to appropriately get rid of excess fluid. To check for edema, gently press down on the individual's skin enough to cause a slight indent. Hold for pressure for about 5 seconds and remove the finger. If the indentation remains, then that is a sign of edema. Typically, the skin will appear taut, shiny, red, or swollen. The final sign discussed in this presentation is PERRLA. This acronym is used when noting the individual's eyes and pupils' reactions are within normal limits. The P means pupils, E equals, R round, R react to light, and A accommodating. If the eyes and pupils do not react within normal limits, it could be a sign of neurological damage, eye infections, glaucoma, or a reaction to certain types of drugs. The final section of this presentation will cover some common scales used in the medical field that can assist RT professionals with providing treatments. The Functional Independent Measure, or FIM, is designed to be used by any trained person, often used in rehabilitation units and hospitals to track changes and outcomes of rehabilitation. It uses a 7-level scale that helps measure the degree of assistance an individual requires to perform or complete a task, where 7 equals complete independence and 1 equals total assistance. All providers using the FIM scale must be certified to do so. The Global Assessment of Functioning Scale is used to describe a person's combined psychological, social, and occupational well-being. This scale ranges from 1 death to 100 total absence of mental or physical problems. The Global Deterioration Scale is a 7-level scale used with clients who have primary diagnosis of dementia and should only be used as a quick description of the client's current level of ability, where stage 1 means no cognitive decline and stage 7 indicates a very severe cognitive decline. Sound is measured in decibels, which measures the loudness of sound. Hearing loss refers to how loud a sound must be before the individual is able to hear that sound. There are 6 levels of hearing loss: normal, mild, moderate, moderate-severe, severe, and profound. The Glasgow Coma Scale, or Children's Coma Scale, is used to measure the depth of a client's coma by assessing 3 areas: eye responses, best motor response, and verbal response. The American Spinal Injury Association Impairment Scale measures the severity of a spinal cord injury based on the nerve damage and the location of the injury. There are 5 levels of completeness that are described in the degree of motor and sensory function loss. Intellectual quotient, or IQ, measures the individual's ability to take in factual information, recall events, apply reason in a logical manner, manipulate concepts, either numbers or words, think abstractly, analyze or summarize ideas or information, problem solve, and prioritize. There are 10 levels of IQ. The mini mental state examination measures the ability in a broad scope of skills, including orientation to date, short-term memory, attention, calculations, recall, language, following 3-steps commands, simple writing skills, and a simple test of spatial drawing skills. The Braden Scale for predicting pressure sore risk is an internationally recognized scale used to predict a client's chances of developing a decubitus ulcer. There are 6 sections of this scale that include sensory perception, moisture, activity, mobility, nutrition, friction, and shear. The stages of skin breakdown is used to identify the severity of skin problems on a scale of 1 to 4. The Ranch-Los Lomigos scale is used to identify the level of cognitive disability as a result of a traumatic brain injury on an 8-level ordinal scale, with 8 being the highest score indicating functions are within normal ranges. Orientation times 3 is a general term used to express whether a client is oriented to time, person, and place. Range of motion usually has multiple scales, each joint in the body having its own scale that measures the degree of flexibility for that specific joint. The 3-step command is not a formal scale, but is a commonly used ordinal scale to describe a client's ability to perform tasks from short-term memory. 3-step commands can be broken down into 3 levels: 1-step command, 2-step commands, and 3-step commands. The Brief Cognitive Rating Scale is a quick assessment of a client's level of impairment due to dementia. There are 5 subsections to the Brief Cognitive Rating Scale that measures concentration, impairment of recent memory, impairment of past memory, orientation, functioning, and self-care. The Wong-Baker's Faces Pain Rating Scale is a picture containing 6 faces that is presented to the patient, and they are asked to select the face that best describes how they feel on a 0 to 10 scale. ABGAR, ABGAR, is a quick summary of a newborn's health against infant mortality. The acronym means appearance, pulse, grimace, activity, and respiration. Family APGAR is used to assess the patient's perception of his or her support system. The Family APGAR acronym means adaptation, partnership, growth, affection, and resolve. I realized there was a large amount of information to absorb in this presentation. RT professionals should use caution when selecting a standardized assessment tool. It is imperative that professionals ensure that the assessment selected fits the needs of the agency, clients, programs, and resources available. Consider the following questions when deciding on using a commercially available standardized assessment tool. Is the population on which it was validated or tested the same as the clientele within this agency? Was the assessment developed upon a solid foundation of therapeutic recreation content that would match the programs within the specific agency intended for use? How closely does the content of the assessment match the content of the programs offered at this agency? How extensive is the protocol for administration, analysis, scoring, and interpretation of the assessment? Does the time, money, and resources required to conduct the assessment with the individual clients match those available of the agency?